Hello, I'm Sheldon Wiebe from Medical Imaging, and I forgot what I wrote in my slides, so I made a few notes here in case there's been some new ideas that I've come up with over the last couple of weeks since I've sent this, so we'll see how this all flows. So my project initially started with a real problem that I was dealing with when I first took over as being the interim head of the provincial department, and that was the family physician access to MRI ordering in Saskatoon, which is a discrepancy from the rest of the province where they have access, particularly in Regina and Moose Jaw and Lloydminster. So I had maybe some more resources than other people, and I was able to build a really strong team around this whole concept, and I also got some support from Deb Gubinson and some other people from the Ministry of Health with respect to the lumbar spine checklist. And so one of the things was that the scope was a little bit too big of a problem with respect to a CQIP project. However, it's something I needed to do anyway, and I thought, let's just go with this and figure out what we can do. So we tried to narrow down the scope of the problem, change it to some sort of appropriateness/necessity of the test, and so we built the team. We developed some collaboration with some of the family physicians, and that's still ongoing. And in fact, we're still probably in the infancy of the whole project from going forward now. But the idea initially was to create some sort of criteria for which maybe the family physicians would be able to order these things, like a order selection process. But we kept on hitting different, I wouldn't say necessarily roadblocks, but different viewpoints and different perspective on how to tackle the problem, and we still really haven't landed on anything solid necessarily going forward. But what we did is we followed the ministry-led project that was already going on sort of in a parallel fashion on the lumbar spine checklist, which was specifically trying to decrease the number of CT lumbar spines that were being done, and then follow-up MRI in patients with low back pain. And also engaged with the lumbar spine referral pathway, which is kind of another parallel thing, but it does not quite exactly the same. So we really started looking at data. We used data from the PACS and the RIS system. We got data from the ministry, and to get the sort of current state. And it's complex. The data is difficult to interpret in some fashion, and we're still working on that. But a new concept kind of arose from that, is that what if we sort of took a new paradigm and we created some sort of CME course with respect to the family physicians and the ordering of MRI. Specifically, we could tackle some of the lumbar spine, low back pain problems, and had them included into the process. It's red flashing. And so we're working on a CME course. I've got some people in place. It's going to happen hopefully this fall. We've engaged with the College of Medicine Continuing Professional Development. And in summary, this project was probably too large for the CQIP timeframe, but it was important for me to do. I think I learned a lot of stuff. In fact, we've had someone from our department in each one of these cohorts. I'm in the third, and I've agreed to sponsor the next one going forward. Hopefully he gets accepted into the program so we can continue on.